I'm Billy Jo with Medical Service Company. I'm a respiratory therapist, and I'm here today to show you how to use a Respironics CPAP machine. So on the table you can see this is a CPAP. The CPAP is set to blow air at whatever the doctor prescribes for you to blow. It'll set that pressure. Over here you've got a humidifier. The humidifier we usually recommend to use because it's going to add moisture to the air that you're breathing, and the air can tend to be very drying and irritating to your nose and your airways. So you'll want to take both units and you just slide them together to make one unit. And then we'll just look at the back of the machine for now. In the back here you've got a little foam filter. It just pulls right out of there. You want to wash this filter at least once a week. You can use soapy water, rinse it out and let it dry. Make sure it's dry when you put it back in the machine. It's just going to go right in here. Right above it is a little memory card that pops out. So we're going to turn the machine around. In the back of the machine here we've got a little foam filter. You just squeeze the filter and take it out. You want to wash this at least once a week with some warm soapy water. Rinse it out, squeeze it out, make sure it's dry when you put it back in your machine. Right above it is a little memory card. This memory card's just going to store the data from the machine just in case your doctor needs to use it or to see it. The data it's going to store is just the number of hours you're using the machine, if you're snoring, if your mask is leaking, things like that. And that's the whole back of the machine here. Then you can see right here is a little handle. And this handle is the release button to actually take the machines apart if you needed to take them apart for some reason. Oops. Forgot to plug it in. So this is the plug. We're going to plug it right in here next to the memory card. Okay, so we've plugged the machine in. We're going to turn the machine around so you can see. Right here you've got 4 boxes, and right below it is your on and off button. You can actually turn this knob and go from all the different boxes, but you want the therapy box to be highlighted. When the therapy box is highlighted, you just push the button in and let it up and your machine will turn on. Then you can see this 5 here, that's your humidifier setting. You can actually turn the dial and change that number. And that takes us right to the humidifier. Over here on the humidifier side, you've got this latch. You lift the latch up and you can slide out the water chamber. Inside the water chamber is a hole. You want to fill that with distilled water only. You pour it in the hole, and you can see the max lines that runs all the way along the side. Once you've filled it up with distilled water only, you slide it back in, all the way in, and then close the lid. And then you're ready to connect your tubing. Now you can see on your tubing here that both ends are exactly the same. Does not matter which end you use. Either end will work. One end's going to the machine, the other end's going to your mask. So you take the end of the machine, you connect it right here to this little elbow, and just push it on there. And then you would connect this end to your mask and your machine's all set and ready to go. I hope this was helpful. If you have any questions, please feel free to call Medical Service Company or your respiratory therapist at 1-800-824-1400. Again, that number is 1-800-824-1400.